Yes, I do, Madam Chair.
Tell us about Senate Bill 119.
Thank you. I'm just trying to catch my breath and knots and whatever. Thank you, members of the committee. I bring to you Senate Bill 119. It's expanding the Canadian drug importation program, and I'm pleased that groups representing consumers like the Colorado Consumer Health Initiative, providers like the Colorado Community Health Network, and our small businesses, the Colorado chapter of the National Federation of Independent Businesses, are in support of this bill. You will hear from our supporters and other supporters in person later today, but I sat before you, many of you, last year when I sponsored Senate Bill 19005, the bill that allowed the Department of Healthcare Policy and Financing to start on a road that helps Coloradans save money on prescription drugs by purchasing from Canadian wholesale distributors, manufacturers, and pharmacies. We are one of 4 states embarking on this journey using guidance from our federal partners and many of other states in the process of passing similar legislation. The U.S. drug prices are higher than any other country. A 2017 study from the Commonwealth Fund reported that prescription drug spending per capita in the United States ranges from 30% to 190% greater than in the 9 other higher income countries of Sweden, Norway, Netherlands, Australia, United Kingdom, France, Canada, Germany, and Switzerland. Saving Coloradans on out-of-pocket health care spending is an urgent need. Passing Senate Bill 119 now will give the state the ability to adapt our existing drug importation program implementation to Canadian regulatory shifts and federal legislative changes. And this bill sets Colorado up to move swiftly following federal changes that allow expanded importation. Waiting to act would only delay cost savings for consumers, and we must move forward quickly to realize these savings for Coloradans. For our seniors especially, they can't afford to wait. When the average annual cost for prescription for a chronic illness is more than the average annual Social Security benefit, we have a serious problem. If you are concerned about consumer safety, this bill does not reduce the strict regulations that we already have in place and trust every day. And last year, you set the standards for Colorado, and those will not change. All imported drugs will have to be FDA approved, sample tested for quality, authenticity, and degradation, tracked and traced according to federal supply chain law, and relabeled to meet U.S. labeling requirements. Any drug unable to meet these requirements will not be considered. Patients in Colorado want a fair price for pharmaceutical drugs, comparable to other countries that are paying a fraction of what we pay in the United States. Most of these countries look at what others are doing and paying and use this to negotiate for reducing prices. So if the pharmaceutical companies are relying on the United States citizens and the government to subsidize the reduced prices for other countries, they can use this as an opportunity to balance their cost structure. I ask for an aye vote.
Thank you, Senator Denal. Let's see if there's any questions. I think I have a question for you, and it's similar to the questions I was raising on Senate Bill 107. What guarantees do you have that would suggest significant cost savings to patients or the consumer?
Thank you, Madam Chair, for that question. Well, if this bill, which this is the Senate Bill 19005 from last year, this is all the work that is going to be sent to getting ready to be sent to the federal government, to the Secretary of Health and Human Services for approval, along with 3 other states.
Some of those pages look empty. No,
they are not empty.
I'm just teasing.
I forgot what you asked. Could you repeat the question?
Cost savings.
The cost savings, yes. We have to prove to the federal government that we're going to get at least 30% cost savings or more. So safety to the patient and at least a substantial cost savings. So,
Thank you. Senator Winter.
Thank you, Madam Chair. Thank you, Senator Janelle, for bringing this. So my question actually has to deal a little bit with the bill from last year allowing for Canadian drug imports, and we haven't really been able to fully implement that program, see the cost savings, guarantee the safety of patients. So given that we haven't seen the results from that bill, why are we expanding it before seeing those results?
Senator Janelle.
thank you, Senator Winter, Madam Chair. It's a great question because right now it is in motion to get approved, hopefully, by the federal government. But the Canadian government was a little concerned that we were just focusing in on Canada. And I do believe that there are other countries that also have drugs that are actually made there or produced there and sold to the United States. In fact, I have a fact sheet that I forgot to pass out to you guys that says the majority of drugs that are sold in the United States are already manufactured overseas. The FDA estimates that in 2018, 88% of facilities making active pharmaceutical ingredients and 63% of facilities making finished drugs sold in the U.S. are located overseas. And that has a footnote on it from the Congressional Research Service in Focus Prescription Drug Importation dated November 21st, 2019.
Senator Smallwood.
Thank you, Madam Chair. So I have a few questions. One comment, I can see why Canada's upset because they only have 38 million people, and to try to send all their drugs to a country with whatever 350 million people, I could see causing a concern. So to Senator Winter's point, last year we allocated $1 million to this program. So that's the other thing that's probably happened is hopefully the Department of Healthcare Policy and Financing has 4 new FTEs working for it. And I'd like to know how it's going with our $410,000 that we're spending on pharmaceutical trade consultants and $400,000 of additional personnel services. Who are the folks? How are they doing? Where are we at? We were a year behind Vermont when we decided to spend $3 million, right? $1 million this fiscal year, $2 million next fiscal year was what was in the note for a total of $3 million. $3.08 million. So where are we at? Because I know Vermont doesn't appear to be anywhere yet. So would love an update as to how the folks are. Are they settled in Hick Puff and give them a sheet cake?
Senator Janelle.
Madam Chair, Senator Smallwood, I think that would best be explained by someone that works at Hick Puff to help tell you.
Great. I'll wait till a witness testimony.
Any other questions before we go into the testimony portion of this hearing? Seeing none, we will do that. I'm just looking at the list. We have, looks like 10 people who oppose the bill. And I have 5 people in favor of the bill. So do you have a preference in reference to who would you like to call up first, and we'll be alternating?
I'd like Hick Puff to come up and help Senator Smallwood understand how the folks are and what is happening and what's
Director,
been done.
please come forward. Welcome back to Health and Human Services Committee.
Thank you very much, Madam Chair. If it pleases the chair, I'd like to invite my one of my $3 million in resources up, who's the person
Sure.
running this as an expert testimony to follow my
Please come
comments.
forward.
Kelly, please come up.
And so for the record, just please introduce yourself. We know who you represent, but we need to do that for the folks who are listening in, and then proceed.
Okay, so I'll start. So Kim Bimsteffer, Executive Director, Healthcare Policy and Financing. It's a pleasure to be with you all again this afternoon. I'm here to express support for SB 1109 or 119. I wear two hats before you this morning, this afternoon. One is the overseer of Medicaid and the Children's Health Insurance Program and other safety net programs. The other is a healthcare expert and strategist who intimately understands and is working hard in partnership with you to drive affordability. Now, this bill addresses just that, healthcare affordability, the number one issue voiced by Coloradans and our small employers. Rising prescription drugs are a significant contributor to our healthcare affordability challenge. So this bill specifically expands our ability to import drugs from other countries, not just Canada, and follow up to the bill of last year, Senate Bill 005, and as part of a multi-pronged approach to improve affordability of prescription drugs. So why do we need this bill, which opens up drug importation to other countries? First, at the federal level, the Bipartisan Prescription Drug Pricing Reduction Act will likely reach the floor of the Senate as early as spring. There are amendments to the bill in circulation that would allow for the expansion of importation from other countries. Those countries include Japan, the European Union, the United Kingdom, and other countries the Secretary of HHS may designate, Secretary Azar. Should the Prescription Drug Pricing Reduction Act pass at the federal level, Colorado's Senate Bill 119 will allow Colorado to stay in lockstep with the Fed regarding prescription drug importation. And staying in lockstep with the Fed creates an opportunity for even more cost savings for Coloradans by importing drugs from countries like France, Spain, Italy, Ireland, Sweden, Finland, Denmark, Austria, Japan, and Great Britain. Second, Colorado and Florida are leading the importation strategy nationally. Unlike Colorado's bill, Florida's original bill that was passed last year along with ours includes the opportunity now in that bill to import from other countries in the event that the Fed created that opportunity. Our bill, Senate Bill 19005, was titled Import Prescription Drugs from Canada. That bill could not import from other countries because of the single source limitation, single subject limitation. This bill fixes that unintended limitation and allows us to parallel Florida. And if you've seen the news and the dialogue in the Fed and Florida are closely aligned. Our bill had a missing link. It did not follow Florida in the same way to allow us to import from other countries in parallel. This bill addresses that. Third, we are in communication, specifically my department and myself meeting with the Canadian consulate here in Denver. Senator Smallwood, you are correct. Our population is 10 times larger than Canada. And Canada would like to actively support that voice from Canada coming through the consulate that has concerns. The U.S. population is, again, 10 times longer. It's one thing, 10 times larger. It's one thing for Canada to work with just Colorado, Florida, Vermont, and Maine now. It's another thing for the Canadians to bear the entirety of the 26 states now in the U.S. who want to import. For a country 1/10 our size, to bear that burden of 26 states in process is pretty difficult. Fourth, every Coloradan could benefit from this program. You've heard the numbers. I'll leave them alone for now. Before I turn this over to Kelly, I want to underscore a few things. First, Senator Smallwood, Vermont, was on the phone with us just this week asking to partner with us. They only have 600,000 residents. They need our help. Last week, New Mexico called. They're passing a bill. They need our help. This morning, Illinois called. We are perceived as the leader. On March 9th, we will submit a draft state importation plan, which Kelly will address. And that plan will address importation and how. The resources that we put into effect now are analyzing which drugs we want to study and how much savings will come from those drugs. And the individuals right now have mapped out how it would work. So a very long report will go in on March 9th, and you will see the productivity of the resources that you've provided. And as Kelly will address, as I'll turn over in just a minute, is the process that we can add on, and I think you'll see no fiscal note to this process here. So I'll close with this and then turn it over to Kelly and invite questions after that. Expansion to other countries does not include Syria, Ecuador, or other countries that may be mentioned in scare tactic communications like the full-page ad taken out yesterday in the Denver Business Journal. From a safety perspective, this bill, like the Canadian importation bill passed last year, stays in lockstep with the Fed's safety requirements, which our department is accountable for ensuring. The Fed doesn't allow importation of controlled substances like opioids. What we're talking about in this importation is traditional drugs used to treat many chronic conditions that many of us battle every day. It just allows us to take those drugs or to purchase those drugs at a lower price. With that, Madam Chair, if you'd allow, I'd like to turn over to Kelly, who's our lead pharmacist leading this work.
Introduce yourself for the record and proceed.
Thank you, Madam Chair, members of the committee. Good afternoon. I'm Kelly Swartzendruber, the drug importation pharmacist for the Department of Healthcare Policy and Financing. I work in the department's pharmacy office. Last session, you passed Senate Bill 5 regarding Canadian drug importation. It directed the department to design an importation program and submit it for approval to the United States Secretary of Health and Human Services by this September. I was brought into the department to design the program and implement the bill. I'm pleased to report the state is on track to submit a draft proposal accompanied by our comments on the federal government's proposed rule. As Kim already talked about, March 9th, we can share the significant savings that we anticipate for Colorado employers and families through prescription drug importation. Just to give these statistics one more time, as part of the body of research to develop our state importation program, many facts have come to light. As Senator Janal already talked about, the FDA states that 80% of active pharmaceutical ingredient manufacturers are located outside of the U.S. That's 80%. Further, the Congressional Research Service indicates over 60% of the sites making finished drugs were located overseas. If you look in your medicine cabinet at home, I do recommend that when you leave today, you may find that your medications that are maybe packaged in North Carolina, but they're made in the UK. Or that your medication is packaged in Pennsylvania, but made in Croatia. The foundational research and program designs completed by the Department for Drug Importation from other countries also allows Colorado to take swift action to expand the program should the federal government allow, putting Colorado on the forefront of cost savings passed directly to consumers. Safety has been and remains a top priority for our importation plan. The drugs that we would import would come from FDA-approved manufacturers, in many cases, the exact same manufacturers that are in the U.S. supply chain today for a lower price. I ask you for your support of Senate Bill 119, enabling Colorado to stay in lockstep with the Fed's evolving importation policy, to enable Colorado to lead the nation in importation strategy and approach, to help us reduce the price of prescription drugs, thereby saving Coloradans and our employers money and making prescription drugs more accessible to Colorado families. Thank you.
Thank you very much for your remarks. Let's see if there's any questions. Members, any questions? Senator Smallwood.
Thank you, Madam Chair. Thank you for coming to testify today. Sounds like you're one of the new FTEs.
I am.
So welcome. So I have a few questions on the 3 other employees plus the 5 other employees that we'll get later on this year, according to the fiscal note for Senate Bill 5 from last year.
Executive Director.
Thank you, Madam Chair. I think the total is 5, Senator Smallwood.
Senator Smallwood.
It's possible, for sure. So we have one. We have all 5.
We have one more.
Director.
I apologize, Madam Chair. We have at least 3. I think there's one more coming, and I'm sorry, 2. One more in process. It'll be a manager and consultants are who we're using right now for some of the work that are experts that are navigating between the states. So we have a state call about every other week with the other 4 states plus Utah, which is trying to figure this out. We're working with NASHB together, and consultants are helping us with that. So some of the individual FTEs are alternating right now with consultant work. So it's a little less staff and a little more consulting.
Senator Smallwood.
Thank you, Madam Chair. Because I saw in last year's fiscal note, we had $410,000 just for this last year for the trade consultant, for the pharmaceutical trade consultant, plus 4 FTEs. And then it said next year, 5 FTEs, and I don't know if that was just taking you from 4 to 5?
It should be taking us from 4 to 5. It is not 8.
Got it. So if I could,
Senator
Madam Chair,
Smallwood.
so what are those folks doing? What's our pharmaceutical trade consultant doing? What are our soon-to-be 4 and/or 5 employees, right?
Sure.
What are their
I think it would be
job
more
titles? What are
interesting
they
to have
doing?
Kelly answer that
Ms. Kelly,
question
can you
because she's
respond?
working very hard on it. Sure.
Thank you, Madam Chair. Senator, we have our trade consultants working on application drafting and development, as well as extensive research into Canadian law and federal law, supply chain requirements, anything that needs to go into our program for research purposes.
Senator Smallwood.
Thank you, Madam Chair. So back to the Vermont question. Again, they were a year ahead of us. Everything predicated on the HHS director saying, yes, this is safe and it's going to save money. So they were a year ahead. So how did their program go? Did they get approval from HHS? It's been over a year. Have they been told maybe? Have they been told we need to look into it?
Executive Director.
Thank you, Madam Chair. They're no further ahead than we are. I think we've lapped a little bit. Again, my peer asked for a phone call in time this week, which we spent, and Kelly joined me on that call. I think this is difficult work. I think the report that we will submit will be more comprehensive than any other state has to date on March 9th. We have indicated that we will spend a lot of time with them after March 9th reviewing it with them. And then together, we might be able to combine resources to find the partners in Canada to share in that time and project work, and to share in potentially making it more beneficial and easier for those partners in Canada to work with a couple of states instead of just one. So that's where I think you'll see the partnership. But I don't know if you want to add anything to that, Madam Chair, if that is okay.
Sure. Ms. Kelly.
Thank you, Madam Chair. Senator, just to add to the timeline delay, the federal government did come out with a set of proposed rules with a lot of detail with regulations, added requirements we weren't aware of until in late December. So that slowed down our timeline just a bit, and we needed to work through those additional 172 pages to make sure that our program was in compliance with the added requirements and also the comments we are going to make.
Senator Smallwood.
As did Vermont.
Okay.
Senator Smallwood.
Thank you, Madam Chair. So we're going to plan to submit something to HHS. Is that the March 9th date where we're submitting to HHS? And then if that is the date, did they tell you that it might be a month, it might be a year, it might be a decade? Any idea on when they were supposed to respond saying, yes, our product would be, our plan, our process would be safe and save money?
So,
Executive Director.
thank you, Madam Chair. The March 9th date is the due date for public comment on the draft rule submitted by the federal government for importation. That's the 172-page document. So we aren't just submitting comments to the draft rule. What we're doing is submitting a draft state importation program, which the draft rule asks us to do. Instead of just submitting comments, we're submitting a draft of the entire application for importation. And our comments are within that. So where we believe the draft rule restrains how much savings we could provide, makes it harder for us to do what we want to do, we're including the comments so that they can really understand where they have opportunities to adjust that rule. But that will give everybody, because it's a public comment, a lens into our design. We will submit all the drugs that we're thinking about. will also include, because of the response from Canada and the concerns as we just dialogued about, we will submit an alternative that says, how about if we export generic drugs to Canada to help them? Because the importation process, where we're saving money, is all brands. We're not going to save anything on generics. So that's an interesting opportunity for Canada and us to have a better partnership where they don't just see us as pulling from their supply, but they see us as helping them. So then March 9th is all about meeting the public comment. We have had grand dialogue with the Fed about this in HHS. They're excited to get that. It'll be the first submission that they will review. They called us in the last month and said, how you doing? What can we do to support? And if you've been reading the paper or watching the White House, the president is very interested in moving this quickly. He wants to see this done, and there are a couple states in the lead. It's us and Florida, and right now we're ahead. So I think the president and others are going to push this as hard as they can, as quickly as they can.
Senator Smallwood.
Thank you, Madam Chair, and thank you, Madam Director, for that kind of timeline. That helps a lot, because that is something that people ask me about is, okay, we passed it, where's it at? Where are we going with it? So you mentioned countries that might be in. Canada sounds like it's definitely on the list. Maybe France, maybe the UK, definitely not Syria, which I think that's probably a good thing. What about, is the list that you gave the definitive list, or could it be China? Can it be the Ivory Coast? Can it be Vietnam, India? There are a lot of countries, India and Vietnam in particular, whose drug prices are way lower, as I read about them, as compared to Great Britain or France even. So is the list you gave us definitive? Is the list of no-goes definitive? Is it possible that my drugs are going to be coming from China?
Executive Director.
Thank you, Madam Chair. Thank you, Senator Smallwood. So the original draft bill, the original draft rule coming out of the Fed challenged each state to meet a couple of requirements. One was safety, and the second was savings to consumers. And so when you look at that safety requirement, we have to conform as a state and as a Department of Healthcare Policy and Financing with the federal rules. So the countries chosen, like Canada or Japan or United Kingdom or the European Union, which includes 27 countries, all have a version of a cooperative arrangement with the United States for reciprocal drug plant inspections and have verified current good manufacturing practices. So Canada, with us, has been in place, that agreement, since 1973, Japan since 2000, the European Union Mutual Recognition Agreement since 2012, and the United Kingdom since 2019. The original EU requirement, the Fed just added Great Britain or the United Kingdom because of Brexit. So we are conforming with the countries that we choose in line with the federal government to ensure compliance with federal regulations that allow us to achieve the two original objectives set by the White House and the FDA and HHS, which was safety and savings.
Senator Smallwood.
Thank you, Madam Chair. And I think I understand what you said, Madam Director. So that list is the list today, but might change if the feds change it. So if Russia gets added to the list, we would add Russia to the list?
Executive Director.
So right now, there are amendments in process to existing or to going through in this spring, and those amendments are a bit of a moving target. We were researching as recently as this morning on where some of those amendments were, but they will stay in compliance with federal regulations relative to the specific, again, the countries chosen have to be in cooperative arrangements with the United States. And so there are protections in place above and beyond what we would do on our own accord in order to stay in compliance with these regulations. And that gives additional safety. And know that the drugs that are coming through right now that we're using, that more than 80% would be in compliance as well.
Okay. If I could, Madam
Senator
Chair,
Smallwood.
And the reason I'm asking so many questions is because the bill is vague, right? The bill doesn't say these countries like last year's bill, which paradoxically was one of my biggest complaints last year. Is why are we limiting it to one of the more expensive countries instead of the less expensive countries? That being said, I really don't want my drugs coming from China. So if the federal government puts, hypothetically, China on the list or Russia on the list or the Ivory Coast on the list, because they've gone through all of those hoops, I don't see anything in the bill that we're looking at now that says that, well, feds put them on the list, they're going to have it squeaky clean, therefore automatically they'll be in our program because our list doesn't seem to specifically allow or specifically exclude anything. It just seems to, like you said, kind of tail in with whatever the feds say. So let's say just like Greece is an EU country, right? Which already makes me a little nervous, but if the EU countries met the requirements and somehow, some way, China ends up meeting the requirements, is that possible, the way things are drafted today, that our medications could come from a country like China? Or is there something in the bill that says, no, we're not going to just go lockstep with whatever the feds say? If just because the feds are cozy with China doesn't mean that Colorado has to, that we have an out to say, yes, we can include countries A, B, and C because the feds did, but guess what? We've decided that this other country's off the list.
Director?
Thank you, Senator Smallwood. Thank you, Madam Chair. So to your first part of your question, we are staying in lockstep with the Fed because the FDA regulates safety under HHS guidance. And the Fed determines that today, they did yesterday, and they will tomorrow. We had not thought in the crafting of this bill that we should question the Fed, nor did we think that we should question federal regulations with cooperative arrangements between the United States and other countries. We didn't feel that that was our opportunity, nor should we make those decisions. So we are inviting through this bill us to stay in lockstep with our federal partners. Relative to the concern of specific countries like China, I would like to just be transparent that today, the drugs that you or your family or your neighbors would utilize, there's a really good chance the ingredients might be coming from China, in the same way that they may be part of other goods and services that you purchase. That right now, as Kelly iterated, that more than 60% of some of those ingredients are coming from sites in other countries. I think that was more than 60%. You can correct me in a second. But still those ingredients have to come through countries that have gone through this process to verify quality through FDA and HHS and conform to these cooperative arrangements. If over time Russia or China were added through the U.S. to these cooperative arrangements and the FDA through their federal regs said those countries were approved, this bill would have the intention to mirror what goes on at the federal level, not to question it or adjust it at this time in its current state.
Thank you very much.
Yeah, thank you for your tolerance as it relates to responding to these questions and adding remarks, because it really helps us to inform our decisions moving forward. So I have a question that springboards off of what Senator Smallwood was mentioning, which was the consultant fee. Just out of curiosity, I think he mentioned $410,000 for consultant fee. Is that a one-year fee, or can you just kind of elaborate more about, is it like a team, like a consultant firm, or, because it seems kind of pricey to me, but I don't hire consultants that expense.
So thank you, Madam Chair. We are not paying any one consultant $400,000. We have one of them that's been helping us for a little while. We just hired another one who is, his name's Ben. He's helping a lot of the states review all of our draft submissions, our comments, public comments, to make sure we're learning from each other before the comments come in and we're disagreeing with each other without good engagement with each other. There are two there. We'll likely shortly hire a third that helps us understand as we choose partners in Canada, which is part of when we submit the final. Right now, we're going to submit a draft state importation plan. And that state importation plan will not include the 5-year history and the exact vendor partners that we will choose, the manufacturer and the foreign partners that we will choose in Canada. When we submit that to the federal government, we have to go and provide 5 years of history on those firms that they're checking. So to do that, we're going to need to hire a consultant that will be rather an expert to help us find those partners in Canada. So there is no one consultant for $400,000. There's experts that help us along the way because we're in uncharted waters.
That clarifies it for me. Thank you so very much. Further questions? Seeing none, thank you both for your time and your remarks today.
Thank you, Madam Chair.
Thank you, Madam Chair and the committee.
So, Senator Janal, anyone else you would like to have proceed, or should we go through the list?
Madam Chair, I'd like opposition first, and then we'll go through the
Okay.
other folks who are in support. That would be great.